I want to talk about amputees. In Barbados, we have a large number of amputees. Are we too quick to amputate? You would say?
Um, well, let's look at the three main reasons why you get an amputation. Person usually have either an infection with the foot, which has the propensity to spread. You sort of save the person. You don't want it to spread because if it spread, they become septic and they might die. So remove the foot before it spreads. Another reason is circulation. Some people have very poor circulation in the foot, and that poor circulation can lead to some type of gangrene. Okay, so you remove the foot before it gets to that is some. They usually do we call a Doppler test, and we look at how the circulation is in the foot, and sometimes some people don't even have a pulse in the lower extremities. So you need to remove the foot. And it's usually signs they become discolored, become dark, becomes person can't feel in the foot, so they remove it. So to avoid that, to avoid it being amputated, we need one of the things you can do is early detection. There is a procedure where the person can have like a graph of the blood vessel that supplies the lower extremities. Right, that's pretty early. You got to get that early, and that is like the person have to come early. You know, and some people don't come early. They come late. They come when they see the foot changing color, or they turn up when they can't feel the foot, and it's too late by then. In terms of infection, if you hit the foot, or because usually in diabetic foot they can't feel, so they either step on a top or step on a rock and get it cut. And the rule is you're not supposed to let the sun rise if it happens in the night, or let the sun set if it happens in the day. Okay? Because the foot have a tendency for infection to spread very fast. So usually these people turn up a week later.
2 weeks later.
When the only thing you can do is to amputate the leg to stop the infection from spreading, because the whole limb is designed in layers, and the infection is spread through those layers very fast, very, very fast. You can have someone, if you give them another week or so, they got that infection spread all up the abdomen. Okay? And it's not a good thing. So that's the reason why you get it, or a lot of infections. It's not so much so that we are doing lots of amputation just willy-nilly. Is that a lot of patients are turning up late. Okay? They turn up late. And the only management at that time is amputate the leg.
But I feel this strong need to hear more from Mr. Denny about his fight.
Well, I'm not a medical doctor, but I would recommend that.
Cuban
I mean, in
program.
terms of the Cuban
That
championing of
Well, Cuba have offered to help us in those areas, and Cuba have developed medication that can help you in those areas, so that you can save the leg. And I think it's something that we should investigate and work with Cuba, because a lot of these poor people that have to remove their legs, that who are working and who want to make a living, and still want to be able to contribute to society. So I think we need to. I understand what the doctor is saying, and I respect what the doctor is saying, But if Cuba have an alternative program and a project that can help, I think we need to investigate and to create the conditions for our people, especially those persons within the public health sector. Because there are a number of people who may end up turning up to the doctor at a late stage because of their economic background. They may not have the finances and the ability to cover the expenses immediately. But I think that if they are given an opportunity to have a wider cross-section consultation at the public health level, that it will help. And I think I don't think we should always look at bringing Cuban doctors to Barbados. I think the whole idea should be centered around retraining Barbadian doctors to deal with these issues within the public health hospitals. Because I think we need to help our people in Barbados, especially poor people.
So it's always known that in terms of healthcare in Cuba, they were top class.
Yeah,
Top class.
They are.
In terms of the pushback you received, tell us about that. Tell us about
Like,
that
pushback.
pushback. Yeah.
Man, it's a big pushback. I mean, and you can look at the evidence. You know, when we were organizing the IKEA program between Barbados and Cuba, lots of poor working class people benefited from that process. I mean, the Cuban get the eyes checked and get the operation. There was a Cuban doctor here at Winston Scott Polyclinic who would examine the person before they go to Cuba and then advise. And that helped. I don't know why the government of Barbados stopped it. With the COVID situation, Cuba helped us in many areas in the medical engineers and nurses and doctors and so forth. And that helped save the lives of a number of Barbadians. And they were able, this is a third world country we're talking about, and they were able to send hundreds of doctors, but thousands of doctors all over the world to help, poor nations in Africa, in Asia, in Latin America, even in Europe, but there were a host of doctors in Italy. So that I think that the DLP as a Democratic Party should do a study on these areas so that when you write the manifesto, you could address some of these areas so that when we win the government, you can create the conditions to help poor people that need medical help. Because it's not only Cuba, I think there are other countries in the world that will be willing to help us in the area of medicine. Because not only the professional doctors may need machinery, there are many other areas. There are Barbadians who live outside of Barbados that may want to contribute to Barbados in terms of buying small pieces of equipment to help us medically. So I think that this discussion is a very important discussion for Barbadian people. And the Democratic Party can create the conditions for us to help our people in Barbados and to help our people when they go to the QEH for medical treatment. Because the workers at the QEH, I know that they want help, but they don't have the facilities, they don't have the equipment, they don't have the materials because of the IMF program that denying us an opportunity to buy and purchase these things for our public institutions. In terms, so we have to address these things. So we have to come up with an alternative program to the IMF program.
Exactly. You're very correct, because even at the start of this year, at the hospital, in terms of simple supplies such as gauze and saline solution, because of the austerity measures in the IMF programs, the funds were not there to purchase a number of these things. And you don't have to convince us anymore. Anything that can be done to assist Barbadians and improve the quality of healthcare, the Democratic Labour Party will definitely champion that. But what I wanted to ask you right now, at this current stage, what are the steps if someone, wanted to get that assistance from Cuba, say for a surgery for glaucoma, cataract? What are the steps that they would need to take?
The first step is that they need to get a letter from a doctor, a medical doctor in Barbados,
Mhm.
explaining with the issues and the problems. And they can do two things. One, they can go through a commercial section that's set up by the Cuban government for international medical treatment, or they can maybe approach the embassy if the person is, don't have the finances to cover those expenses, and then the embassy could put for a recommendation. And once Cuba can help, they will help. The only problem is that the person may need to help pay for the medication because of the political economic embargo against Cuba,
Mhm.
which is it's very hard on the Cuban government.
Mhm.
That's one area. The second area is that if we can encourage the government of Venezuela to go back to that position where they're prepared to help finance a project for Caribbean people, because a lot of the finances came from Venezuela through the Petro-Caribbean Agreement and the ALBA Agreement. If we can get them to go back to that position where the government of Venezuela can cover most of the finances, the professional people are there in Cuba, and then you'll be able to have the necessary equipment, the airfare, and to transport the people to Cuba, then we can put back that kind of free program, so that the Democratic Party should should do a kind of an audit on this whole medical project and see where we can get help from all over the world,
Mhm.
and so that we can help our people. I am prepared to help with such a project because I know it will help the people of Barbados. And we need to create a joint project with the government and people of Cuba that we can train medical doctors, nurses, and engineers in Cuba,
Mhm.
bring them. And I know it'll be cheaper for us than if you send them to the University of West Indies. Bring them back to Barbados and let them work within the public health sector
Sector.
and help our people.
Are the doctors still having difficulty finding persons who are trained in Cuba as doctors still having difficulty finding placements in the healthcare setting in Barbados?
Yeah. You see, the problem in Barbados is that once you study in Cuba or you study the Commonwealth, become there are problems. So you need to do the examination, Caribbean medical examination. And for the Cuban doctors, Barbados haven't put a proper system in place like other Caribbean countries for you to go through that process and to do the examination. And when most of our doctors go to Jamaica, they end up staying in Jamaica and living in Jamaica. And then some of them may end up going and work in first world nations, England, United States of America, Canada, and so forth, maybe to make large sums of money. But that's not the reason why we send them to Cuba. We send them to Cuba so that they can come back to Barbados and help our Barbadian poor people.
Mhm.
Okay, because a number of the students that went to Cuba to study medicine, a number of them could not go to the University of West Indies because they don't have the financial resources,
Mhm.
and they receive everything in Cuba for free and receive a stipend in Cuba while they were studying in Cuba.
Mhm.
So that we have to look at this project or program in a way that there's a strong agreement between Barbados and Cuba for training, and that the doctors can come back to Barbados, work within the public health sector like any other Caribbean country,
Mhm.
and they can do the camps, the examination in Barbados, like any other Caribbean country, so that they can become qualified doctors, so that they can properly register with the medical council, and that there will be no problems.
Mhm.
But we need to do our own homework to accommodate our doctors, and it's really hard, on us when we can send over 200 medical doctors
Mhm.
to Cuba since 1998. and you got 5 or 7 working in Barbados.
And I see from the screen that you're getting some support from the audience with one of our viewers saying it sounds like a great plan, Mr. Denny.
Yeah.
And I definitely do agree with that, because that is why we wanted to have this program tonight, because you cannot we have our healthcare system in Barbados has the footprint there already with the setting up of the polyclinics throughout Barbados, but they're not necessarily functioning as effectively as they should be. We did not speak tonight about dental health, and that is another area where we are falling behind in as well, right? And, you know, not only getting involved, as you would have also suggested, not from the perspective of the Cubans helping us, but also helping us to develop ourselves so that we too in Barbados, this is the stage that we should be at, should be offering this medical assistance to our Caribbean neighbors and setting up health tourism as a next sector for the growth and development in Barbados.
Especially the elderly.
Exactly.
Elderly health tourism for the elderly, you know. I feel, honestly, I feel that the Democratic Labour Party is ready to create a new vision for Barbados, especially from listening to the spokesperson from the Democratic Labour Party. And I think that if we can all work together, we can develop that project that will benefit poor people in Barbados. And I mean, I honestly, and I am not dreaming, I have been listening to the leader of the Democratic Labour Party, Ralph Thorne, and the spokesperson from the Democratic Labour Party on education. I mean, I see something in her and other spokesperson, agriculture. I just read a document on agriculture. And I think that you're on the right path. Just look at creating an alternative to that IMF program. I think that's key. And I know that you'll be able to create the conditions for all of our social services in Barbados.
Well, I'm glad, and it was music to my ears when you said, when we win the government.
That's why that's the reason why I'm here.
Yeah, that's definitely so. Now, we speak about, wellness, health and wellness and so forth. We speak about the physical side of it. We speak about biology. Now, you have you've done some research in terms of the spiritual side.